You probably have many questions about your upcoming cardiac surgery, and that's normal. In this video, we will try to answer many of the questions you may have. The video is divided into 3 sections: before the surgery, during the surgery, and after the surgery. Let's start by distinguishing a cardiologist from a cardiac surgeon. Who does what exactly? The cardiologist takes the medical history, does the physical examination, does the treadmill test, also known as a stress test, as well as the EKG or other tests as required, performs the angiogram and other tests if necessary, prescribes the medication that is required, may put in stents or a pacemaker, does not operate, will refer you to a cardiac surgeon if you need an operation. The cardiac surgeon reviews the cardiologist's recommendations, meets with you before the surgery, takes your medical history, and does a physical examination, performs the cardiac surgery, does a follow-up before and after the surgery, and makes recommendations to ensure the success of the surgery and avoid possible complications. Here are some questions you may have about what will happen prior to the operation. Do you have to continue taking your medications until the day of surgery? Some medications, yes. Your cardiac surgeon, the one who will perform the operation, will tell you which medications to continue and which ones to stop. If you are unsure, feel free to call the office directly. Do I need to stop smoking before my surgery? Yes. It is better to stop smoking because it can reduce lung complications. It will improve the efficiency of the pain medication or painkillers and the healing of the incision. It will also help you to recover more quickly after the surgery. What determines how long the wait is before I get to have the surgery? Your wait time to have your cardiac surgery depends on your test results, your symptoms, and if other patients have a more urgent surgery. For this reason, your surgical date may change based on more urgent cases. There is a system in place to know which cases to prioritize. The surgeon's office will call you to tell you the date and time of your surgery. What should you do if your condition or symptoms change? If you have more shortness of breath, more chest pain, or other symptoms that are getting worse, do not hesitate to contact your cardiac surgeon or your cardiologist. If in doubt, go directly to the emergency department. Here are some questions you may have about what will happen one day before the operation. Do I have to fast before the operation? Yes. One day before the operation, you must not eat or drink after midnight. When will I be admitted to the hospital? The day of your surgery. If you are considered an emergency patient, you will already be in the hospital. Are there any tests that need to be done before the surgery? Yes. A blood test, a chest X-ray, a lung exam, or other tests may be ordered. The tests needed will depend on your condition. What should I bring with me to the hospital? You should bring an extra coughing pillow to be able to cough properly, pajamas or comfortable clothing, underwear, socks, shoes or slippers, all of your medications in their original pharmacy containers, your health card, a razor if necessary, personal care products such as soap or creams, toothbrush, toothpaste, etc. Do not bring anything with value. It is kind of like going on a trip for a few days. Why are the chest and legs shaved before surgery? A member of the nursing staff will shave your chest and legs so that everything is clean and ready for surgery. If you need a bypass surgery, the vein may be taken from the leg. Do I need to shower or bathe before the operation? Yes. The day before or the morning of the operation, it is important to bathe with an antibacterial or antiseptic soap that has been recommended to eliminate bacteria on your skin and reduce the risk of infection. It is recommended not to use any creams, powders, makeup, or scented products after you wash. How long do I have to stay in the hospital? Between 4 to 5 days on average after the surgery, depending on the state of your health. In some cases, the stay may be a little longer. When you are discharged from the hospital, please have someone drive you home. Is it normal to be stressed and always thinking about my surgery? Yes, it is quite normal. Everyone experiences the surgery in their own way. Most people prefer to prepare themselves mentally for the surgery and to know what is coming. This way, you will certainly feel better informed. Do not hesitate to ask questions to your cardiac surgeon or your cardiologist. They're there for you.